that we were able to discuss new technologies and new facilities like PARS, where people can have intervention without surgery. I have been here for the last 2 days, seeing patients and looking to their infrastructure. I think Kashmiris should be very happy that they have a good hospital here with all the facilities like we have in America, and they have excellent cardiologists, excellent skills. By that, people don't have to go outside J&K. They can come here and have all the facilities, particularly now the heart disease. Heart disease is the #1 killer in the world. And they have all the facilities here. I think as a press, you need to make people aware of symptoms of heart attack, because a lot of people are dying here because of heart attack. The key thing is the early recognition of symptoms and coming to quickly and have the treatment, or we can open these blocked arteries which cause a heart attack. So I think that's all I have to say is that I'm very pleased. I've been here for 2 days, that we have a great facility here with great skills, great experienced doctors here, which can do a lot of things, or as we do in America. They have all the facilities here.
7 years ago?
Yes.
You were actually planning to set up a hospital here, but the then government refused to do it.
Yes, you're right. It was about 10 years ago. I had this dream of developing a hospital where patients who can afford to have it done. Then I don't want to go to the politics.
How much medical, as far as medical facilities are concerned, how much change you have noticed it?
Tremendous change. I think the facilities are phenomenal now. I mean, I've been here for 2 days at PARS, and I'm very impressed. Much better and more facilities than when I was here 5-10 years ago.
Many young persons have been died, with the heart attacks.
Yeah.
We have seen past many years. What is the main reason you have find that many young people have been died with this disease?
I think the #1 is people who smoking. Right. #2 is diabetes. We call the silent killer. Every 4th person in Kashmir is diabetes. Then patients with high blood pressure, and also patients with bad cholesterol level, high cholesterol, especially LDL. Patients with family history, if somebody's father, mother, brother had a heart problem, they are more likely to have the same thing. And the stressful situations and not having good lifestyle, eating habits. These are the really things which a person can have and develop these blocked arteries which nourish the blood to the heart. So I think we have also learned that right from the childhood, if you give them the right food, and to make early diagnosis of blood pressure, early treatment of diabetes, early treatment of high cholesterol, if you do that, you can prevent not only heart attack, you can prevent surgery, you can prevent angioplasty, because there is so much of advance now in these early checkups, early treatment, like a car. Suppose you have a car, you get regular checkups. That is important, not to wait till something else happens. Make early checkups, early diagnosis.
People are using the junk food so much today in today's life.
Well, that is the #1 cause then, as I said.
What precaution should we take in case of health, especially heart disease and other things like that?
Well, what we have to do is, if you are diabetic, to have the right treatment at early stages. And the eating habits, exercise, if they have high blood pressure, to get early treatment, not to wait till something happens. Same as if their cholesterol is high. We have now great drugs we call statins. They are modern medical medicines. So if you have a very high cholesterol, a bad cholesterol called LDL, you give them statins, there's a 50% reduction in heart attacks with that medicine called statins. That can even prevent new blockages if you give them early. That's the key thing, early lifestyle changes and early treatment. And people have to be aware, if they have chest pain, with shortness of breath, a pain going down the left arm, they're sweating, this could be the part of the heart attack. And they have to get early treatment for that.
So after stent procedures, I've seen people here, they still have suffered heart attacks. That means despite stenting procedures, they still are on the same page. So what do you have to say about it? Second question is, how do you see the health scenario here, be it in government and private as well? So could you please enlighten us about the early diagnosis of cardiovascular disease? Because delayed diagnosis, it really risks the lives of people.
I think when you talk about early diagnosis, what checkups you need, do first simple blood test to check they don't have a high bad cholesterol. Have a early checkup that they don't have high blood pressure because they may have no symptom. Same as diabetes, a silent killer. There are people walking with HbA1c of 8, 9, 10, and they're not aware that they have the sugar problem, and that is to be addressed very early. We call this HbA1c level has to be less than 7. Same as the LDL level has to be low. And if you suppose have a stent put in, but you don't change your lifestyle, you don't treat your hypertension, you don't treat your sugar, they're going to have a new blockage. That's what can happen. You can have a stent, but there are 3 other arteries. You can develop new blockages. And you have to change your lifestyle. That's the key thing.
How do you see the health scenario? Do you think government?
Well,
We need to upgrade our healthcare system here, be it in the government hospitals, private hospitals.
I haven't visited any government hospital, but I know when I used to come to SKIMS 5-10 years ago, they made a tremendous progress while watching them to grow. But I can tell you from the private sector, it's the only hospital I had an opportunity to see. And as I said earlier, I have been here for 2 days seeing patients. I just did a procedure before I came down. I'm very impressed with the facilities they have.